Hello friends, so today I am going to talk about Menieres disease. So in this video I will talk about sign and symptoms of Menieres disease, different audiological and otological tests we do to diagnose Menieres disease. I will also talk about pathophysiology of Menieres disease and the treatment of Menieres disease. So let's start with sign and symptoms of Menieres disease, means what all complaint you can get from a patient with Menieres disease. So the first complaint may be heaviness in the ear or blocking sensation in the ear. The second complaint can be tinnitus or ringing sensation in the ear. The third complaint can be vertigo, which lasts for at least 20 minutes or more. Or more means it can be for half an hour, it can be for 1 hour, it can be for 2 hours. Then I want to talk about the pathophysiology of Menieres disease. So before talking about the pathophysiology of Menieres disease, I want to talk about the anatomy of our inner ear. So as you all know that inner ear is something like a tube within tube structure. So there are one tube and then on the above there is another tube. So that the two different tubes are called, one is called a bony labyrinth and the another one is called membranous labyrinth. So in bony labyrinth there is a fluid called perilymph, and in membranous labyrinth there is another fluid called endolymph. So if you cut the cochlea cross sectionally, you may find out three chambers. The first chamber is scala tympani, the second one is scala media, and the third one is scala vestibuli. So in scala tympani and in scala vestibuli there is a fluid called perilymph, and in scala media there is another fluid called endolymph. So why I am talking about these fluids? Because in the patients with Menieres disease you can find out excessive amount of endolymph. And because of this excessive amount of endolymph, the patient may feel heaviness in the ear or blocking sensation in the ear. The patient may have hearing loss. The patient may complain of vertigo. So all these things are happening because of excessive amount of endolymph in the inner ear. So excessive amount of endolymph is the reason of all these problems. So now let's talk about audiological evaluation for the patients with Menieres disease. So first of all, we do pure tone audiometry. So when you do pure tone audiometry, you can find out a peculiar type of audiogram, that is low frequency sensory neural hearing loss. So usually sensory neural hearing loss occurs at high frequencies, but in case of Menieres disease, you can find sensory neural hearing loss in lower frequencies. So that is a very peculiar type of audiogram that you can find in patients with Menieres disease. Okay. Then you can do speech audiometry. You can also go for ECOGSY, electrocochleography. Then you can also do VEMP, vestibular evoked myogenic potential. You can also do autoacoustic emission test. And above all these audiological tests, we can do an additional test that is called glycerol test. So what actually we do in glycerol test? We administer glycerol, and after the administration of glycerol, one can find an improvement in thresholds, a significant improvement in threshold. So if after administration of glycerol, if in your audiogram you can find out a significant improvement in threshold, you can suspect for Menieres disease. So let's talk about the treatment of Menieres disease. So in treatment of Menieres disease, your doctor may prescribe you some medicine to reduce the amount of endolymph from your inner ear, or the doctor can do some kind of surgery to eliminate extra endolymph from your inner ear, or many times they also cut the vestibular nerve to reduce the symptoms of vertigo and all. So thank you for watching the video. We will meet again in the next video. Bye bye.